This is Shanna Dethi here live at this Digital Health Studio at CES 2019. I have the pleasure this afternoon of speaking with Michael DePalma, who is the founder, president, and COO of Hu-Manity.co. And we're here to talk a little bit about blockchain. So I am asking Michael to explain blockchain to all of us in a form that I'm hoping can understand.
What is it besides a buzzword, you mean?
Yes,
Okay.
What is it besides a buzzword?
So you can think of it as the next iteration of the way databases work, but it works in a fundamentally different way. Typically, databases are centralized structures, right? What blockchain really is a way to rethink the way we think about how information needs to be structured. So it's basically a hypothesis. We look at it this way, is can you take things that were centralized and hierarchical and break them apart, right, so that they're completely decentralized, but you can use cryptography to create truth and trust. So that's what you do. You sort of turn the model on its head, and that's what blockchain allows us to do.
Okay, so let me see if I understand this. So I grew up in the time when first databases, everything was like flat files.
Yeah, me too.
Okay, and then we learned about relational databases,
Yes.
right? So now is it kind of like taking the parts of the relational databases and putting them in different places?
Well, that's kind of schema. That's one way you can look at it. Look at it this way. So one of the challenges that you have with things like spreadsheets or flat files or databases is, let's say you've got a copy and I've got a copy.
Right.
And I made a change to mine, right?
Yep.
Now, how do I make sure that my change and your change are the same?
That's what the amazing interface people do, right?
It was fun, right? Exactly. And so you do that times millions,
right?
And it gets nuts. And so what blockchain allows you to do is create this sort of center of truth, because what you have is records chained together, okay? So you've got this sort of immutable ledger. So once we write something to a database, it continues to be written forward so that we never lose that information, but it also creates consensus so that now we have exact copies of that information throughout all the nodes.
Got it. So what type of areas is blockchain being used today?
It's being used all over the place. Listen, it's kind of a nascent space, right? Right now, the way blockchain gets used most oftenly is cryptocurrencies. That's not the space that we're in. We're looking at blockchain as a fundamentally different thing. We're not interested in cryptocurrencies so much as we're interested in, can you use blockchain as a consensus mechanism to empower people to own their inherent human data? That's the way we look at it, is can you create a structure that allows you, me, everyone in this room to own their data as property, to have some level of control and authority over it, so that now I understand how, when, where, and why my data is being used, and I have the opportunity now to be compensated for it.
Right, so that's fascinating. So what kind of models do you see coming forth in the future? So if I was to, not that we have a crystal ball, but I'm sure you're kind of a visionary working in this space, so you probably have some really good ideas of where you think it could be going. Why don't you share a little piece of with that
Sure.
today?
So we're actually beginning in the medical area. We're beginning with human health data. So what most people don't understand is that the human data, health data, information about you, is being bought and sold every day on secondary and tertiary markets without your knowledge, without your consent, without your awareness in most cases. You don't know it, your doctor doesn't know it. So you go for a physical, your labs are being sold, your EHR records are being sold, your prescriptions are being sold. All of that's being monetized downstream to the tunes of tens to hundreds of billions of dollars. And so the simple question I ask people is, how much of that did you get?
None.
Well, that's an interesting question, and you start to ask why. Why is that? Who owns that data? So we're beginning, our beginning use case is in human health data, medical information, if you can own that information, you now become part of that economy, part of that ecosystem. We're here to empower you, but at the same time, through property ownership of data, not only are we empowering you and providing real monetary value to you, but we're also accelerating our ability on the other side of things, like how do we do research? How do we connect people to clinical trials? How do we ensure that we've got better quality data? How do we ensure that the stream of data, it not only continues, but is much larger? So the whole idea of rethinking this data economy, this ecosystem, actually pays dividends across the entire industry.
Well, that's great. Is there anything else you'd like to share while you're here with us today?
Well, this is my first time at CES, so I have to say that. It's been quite an experience. It's interesting, so we're in this giant room right now, and I'm looking at every booth is a technology that captures and or uses data. And so what we've just discussed is particularly prescient if you look around.
It's super important. I'm really excited to see where this goes in the future.
Me too.
Thank you, Michael, for joining us today.
Pleasure, thank you.
And this is Shanna Dethi here at the Digital Health Live Studio at CES 2019, hosted by Living in Digital Times.